All right, hi there. This is a video about the different psychological disorders. However, just a kind of disclaimer, this is not a video going into any level of detail about any of the specific disorders or even clusters of disorders. There's so many of them, it's going to be hard to encapsulate that in just a single lecture video. You would need a lot of time to kind of properly address all of those. So rather, this is kind of an overview of mental illness in general, and some key factors that we want to be aware of in regard to psychological disorders. Okay, I think probably the first thing that I would want to emphasize is that this is something that's actually extremely common. All right, most research is going to indicate that 1 in 4 Americans suffer from a mental illness in any given year. Right, so the number fluctuates a little bit between 1 in 4, 1 in 5, but it's roughly in that 20 to 25% range. Right, so this is maybe a little more common than what most people realize, and I would say that number might actually even be just slightly higher than that, because we want to also consider how research is done, and we're probably maybe looking at people who are receiving treatment, and so then how many other people are suffering who don't seek treatment or who aren't reporting it. All right, so the number could be just slightly higher. Okay. That being said, though, not all mental disorders are kind of created the same, right? So that's the overall what we call prevalence rate, right? What we also are going to see is that each individual disorder also has its specific individual unique prevalence rate, and that certain types of disorders are more common than others, right? So, for example, if someone is experiencing mental illness, there's a pretty good chance that it's something to do with depression or anxiety. Right? Those are the top two. They make up the largest percentage. Okay, so depression, anxiety are at the top. From there, we have a decent drop down, and then we're going to look at all these substance abuse disorders. Right, so anything dealing with addiction and things along those lines, and then there's a pretty big drop after that for everything else. Right, so if someone's seeking out therapy, most likely, again, depression or anxiety, not necessarily like a personality disorder. Those are very interesting to learn about, but we're talking 1% or less on average for a prevalency rate, not occurring too often. Okay. The other thing that we want to consider with mental disorders is that we are looking for a very specific set of symptoms. Right. What will often happen is that if you're in an abnormal psychology class, or as you're looking at different mental disorders, as you go through each individual one, you start to think to yourself, that's me. I have that, right? That is describing me. I do this. Therefore, I have this disorder. Most likely that is not the case, right? There's this very specific book that we use here in the United States. It's called the Diagnostic and Statistical Manual, DSM. It's currently in its 5th edition. Okay, so with this manual, it's produced by the American Psychiatric Association. It's a reference text, and it's going to have a list of every single disorder. There's 200 plus of them, and for each one, it's like, here are the criteria. These are the things that you have to be experiencing in order to receive this diagnosis. And for each of those things, there might be 3 or 4 symptoms listed. There could be up to 10, right? But the thing is you have to have all of them. Okay, not just 1 or 2, all of them, right? So what we'll often find is as you go through, you might see, okay, yeah, I do this, or I do that. But unless you have all those criteria, unless you meet all the symptoms, then you don't meet the criteria to have that diagnosis. So what we're often going to see is that all of us have our quirks, or things that are unique about us, or things that we do, but that doesn't necessarily mean you have a mental disorder. Okay. The other thing is like, let's say you are experiencing some of the related symptoms, okay, and you're hitting the checkbox on a couple of things. That still doesn't mean you have a mental disorder or you need treatment. Pretty consistently, what we're going to see across the board with all these different disorders, as we look at the criteria, one of the things that's always going to be in there is that we want to look at, how is this negatively impacting the individual? With the symptoms that they are experiencing, in what way is it preventing them from living a normal life? In what way is it preventing them from being successful in their job or in school or with relationships, right? How is it negatively impacting that person, right? If we can't show that, then they're not going to meet the criteria, right? So when we look at mental illness, it's not just experiencing symptoms, but those symptoms have to be distressing. They have to be causing a negative impact in some kind of way. We want to look for dysfunction. How is that person not able to live their life in a healthy, happy way? How is it preventing that? Okay, that's one of the key things that we want to look for. Okay. The other thing is that there's 200 plus diagnoses out there, different disorders. And so we want to make sure each person has the correct one, right? So prior to actually providing a diagnosis officially, we should engage in a process of what's called differential diagnosis. So we want to say, okay, this person, they have all the symptoms for anxiety. Let's just double check. Let's make sure. What are other things, other disorders that could potentially explain what's going on as well? Okay. Now, the reason that this is important is because whatever diagnosis is given, that then is going to inform what type of treatment is provided, right? So if you get the diagnosis wrong, that means whatever treatment is provided, it might not match up. It might not complement each other, okay? So, common example. When we look at something like depression, right? So a client comes in, they have all the telltale signs of depression, they meet all the symptoms, they meet all the criteria, boom, this person is depressed. Before we give that diagnosis, we need to do a differential diagnosis and check what are some other possible explanations, right? So one of the things we always look for, is there any substance use that could explain the symptoms? Okay, that's a possibility. We also want to consider, are there any medical conditions that could cause those symptoms, right? And so in the case of depression, the answer is yes. There is a condition involving the thyroid that if you have this, it's going to mimic all those symptoms of depression. And so if you don't do a proper differential diagnosis, what we're going to find is that someone's going to say, oh, okay, you have the symptoms of depression, you're depressed, boom, here's the treatment. We're going to try antidepressant medications. We're going to try the different types of talk therapy, whatever it may be. And it's not going to work. And the reason it's not going to work is because the person's not depressed. They have a problem with their thyroid. We need to properly diagnose that. And if we can get the treatment for the thyroid, the symptoms then take care of themselves, right? But we cannot properly determine that if we're not doing our due diligence and giving the correct diagnosis, okay? So those are just some of the key principles that we will look at when it comes to mental illness. Just know that it can be very debilitating for many. There's a struggle that often people go through, and it can be very difficult for them to work through those things. And we want to make sure that we're doing everything we can on our part to reduce stigma related to mental illness, and that we can support those around us who are going through something, right? It's not so simple as just telling them to get over it, right? What we're going to find is that if someone had, let's say, diabetes, right, and they need to take medicine for their diabetes, I want them to take their medicine. I want them to get the treatment they need. Oftentimes, what we're going to find is that mental illness is the same thing, right? There are some individuals that nothing's going to work for their anxiety except for getting on medicine. Go get your medicine, right? If that's what's going to help you. We don't need to stigmatize that. We want to make sure people feel open to seeking treatment, talking about their needs and their concerns, and that we can be there to support them. All right, so I'd encourage us to maybe be familiar with the different types of mental illness that are out there, be familiar with the different types of resources that are available, and do what we can in any kind of small way to support those that we come in contact with, our family, our friends, and others, and how we can help them with their struggles.